So what exactly is happening with our vaccination drive? I'm joined now by Professor Linda Gale-Becker, the co-lead of the eNCA COVID vaccine trial. Prof, good evening. We know that about 10% of healthcare workers have been vaccinated. The Deputy President saying they're hoping to get all the healthcare workers vaccinated by sort of mid-April. So that's like about another 1 million people that need to be vaccinated. Are all those healthcare workers due to be vaccinated with the J&J vaccine?
So, Sally, I don't think so, in as much as my understanding is we have 500,000 doses coming to us through eNCA, as was said, under the auspices of a research implementation study. Mm-hmm. So that 500,000 will take care of, again, a proportion. And then I understood that government was bringing in Pfizer Doses that would top up the rest of the healthcare workers. And remember, we're targeting patient-facing healthcare workers, those most at the front line first, and then moving from there.
All right. So am I correct then that the 500,000 is coming from Johnson & Johnson?
That's right, okay. Yes, as research doses, as opposed to commercial doses.
Sure, I understand. So just if you could clarify for us, because I think there's a lot of silence and there's also quite a lot of confusion. How many Johnson & Johnson doses have actually been sent to South Africa so far?
So we have in hand, well, as you know, we've vaccinated 170,000 and basically used up all the doses in the country so far. Then we've got 66,000 coming tomorrow, which is great because that's a nice injection, which will take us over the 200,000 mark. Mm-hmm. And we have another 300,000 promised altogether.
And when will that 300 remainder arrive?
So they're supposed to be coming in sort of tranches of 80,000 every 1 to 2 weeks. And the reason these are coming in these seemingly small amounts is because, first of all, they're coming to us as research doses. They're coming to us from all over the world. And they're having to go back to Belgium to be relabeled and then sent to us. But we didn't want to wait till all 500,000 were together because we recognize the urgency here. And so as soon as they get to Belgium, they're coming to us, we're putting them into arms. So we're expecting eNCA to kind of finish its work mid to late April, I think, is where we're sort of imagining we're still going to play a role here as eNCA.
And obviously the Pfizer 500,000, that will fall under eNCA as well, I imagine, because that's for the healthcare workers.
It is for the healthcare workers, but it's outside of eNCA. Then it will come in, and my understanding is it will then launch the official government rollout plan, so that it will come in as a commercial transaction, and although it is destined to go to healthcare workers, it'll be that initial first phase that if we cast our minds back to a month and a half ago was what was supposed to take place, as we all know, with AstraZeneca at that time. So we'll pick up there again.
All right. Yeah. Do you have information about when the Pfizer doses are arriving?
Afraid not. I'm hoping it's going to overlap as we finish up eNCA. There won't be a break, and Pfizer will kick in. And again, I've heard times such as end of March, but we obviously are very dangerously close to the end of March. So hoping it'll be soon.
I want to get your input, if I may, on something that Professor Alex van der Heever in the clip that we just played highlighted. And this relates to a Bloomberg article that says that the Aspen Pharmacare Holdings is going to, within the next 3 months, start producing COVID-19 Johnson & Johnson vaccines here in South Africa, in Port Elizabeth. But here's the rub. According to the article and according to what the Prof says, is that those first doses are going to be shipped out of Africa. We already know that Africa as a whole is right at the bottom of the pile in terms of how many vaccines have been rolled out. And Prof van der Heever says it's absolutely scandalous that those doses manufactured in South Africa are apparently going to be shipped out to Europe and the USA first. Do you have a view on that?
Yeah, I mean, I would like to just clarify where, the information Professor van der Heever has. My understanding that this is not being manufactured in the country. It is being sent as a vaccine to be filled and labeled here. So it's kind of the finishing of the product. And I presume the vaccines themselves have been purchased by other people a long time ago. So, this is, to my mind, the bun fight that is going on around the world, and that's a bigger issue. And I think, Prof. van der Heever has to just clarify whether he means that it's being manufactured here. That is not my understanding. I did not know that we had the manufacturing capability here. I think the first sort of aspect of tech transfer, whatever, is that actually the filling and the finishing.
All right, let me. So you can help understand this better than I can. This is from the Bloomberg article from today. Since agreeing in November to produce as many as 300 million doses a year at its plant in Port Elizabeth, Aspen has adopted the technology needed for production, Saad said in an interview on Friday. The company has sufficient capacity to more than double that output if needed, he said. Does that change the picture for you?
I don't really read into that he is meaning that he is making the vaccine, the Ad26 SARS-CoV-2 vaccine.
But nonetheless,
and I think that's what we need to clarify.
Sure, I hear you. So you're saying it's not necessarily being actually made, but it's potentially being bottled and distributed from South Africa, and still we're at the back of the queue is the point. So how do you feel about that even?
I feel terrible about that. I mean, I've said it on many platforms. This is a problem. I think it's a problem globally with our approach to public health, and it needs to be changed at a very fundamental level. I think that many would agree this is, these commodities should be seen as public good commodities, and as such there needs to be a different dispensation where there is more equity around the world. Having said that, I think it's a shame that we kind of did get to the back of the queue. I think we were very reliant on COVAX, and I think COVAX has taken some time to get to where it is able to distribute vaccines to LMICs.
Are you sorry? I just missed what you said. Are you saying that we were perhaps too reliant on COVAX and didn't show enough initiative as a country?
I think so. But, again, there are those who argue that, maybe, we could never compete in the bilateral sort of agreements just because of the need for upfront cash. And I can see that as a difficulty as well. But the fact of the matter is, whatever happens, this commodity is going to be rationed because we need so many doses to feed a worldwide pandemic. And that's the crunch. It's just, is there enough vaccine in the world? There isn't. And, he who pays first and pays most is going to be at the front of the queue.
But aren't some African countries doing better than us? I mean, Morocco seems to have vaccinated more of its population than we have. That's not a wealthy country.
Yeah, so I'm presuming that they did actually move and they made deals, and they made the deals
Rwanda is another
sooner than we did.
Rwanda's another example. What did they do Rwanda, that we didn't do?
Yeah. I presume they asked COVAX sooner. They got to the front of the queue, and I'm making presumptions here that it's about having moved sooner than others.
Yeah. Well, and I'm sorry I'm asking you these questions. We have been asking the Department of Health to answer these questions for us, and we understand that they asked you to come and speak to us. So thank you for the clarity, at least, around the 66,000 doses of Johnson & Johnson arriving tomorrow, and the rest, the other 300,000, did you say, when will those be arriving?
Well, we see that these should be with us certainly by the end of April. Again, I don't want to make any false promises. We're hearing week by week when they can be shipped out, but we had been told by our Johnson & Johnson partners that this would be done and dusted by the end of April. So that's what we're hoping.
All right, well, let's hope so too. Certainly ahead of the second wave, if we can inoculate our healthcare workers on the front line. Thank you very much for your time this evening. I really do appreciate it. Professor Linda Gale-Becker, the co-lead of the eNCA COVID vaccine trial. Well,